Good evening and welcome to the Digital Excellence Pharma Academy, Dr. Tejal. It's wonderful to have you on our program, and you have a very impressive track record. Could you tell us a little more of your journey as an endocrinologist, your early days as a medic? I think you graduated from MGM from Sevagram, so that would have impacted your approach to medical care.
So if I can take the second part of the question first, that probably it was the early days as a medic, which ultimately influenced the specialty that I chose. And as you said, I trained at Sevagram, which services a lot of rural population. So much of my early MBBS days were spent working with underprivileged people, and I think that gives you an insight into the difference that you can make in somebody's life. I also had a very interesting experience where after I completed my MBBS and internship, at that time from Sevagram, it was compulsory to have 1 year rural service. So I worked in a small town 20 kilometers from Bharuch. It was in the interior of South Gujarat, and there you had to do everything. So you had to deliver babies, you had to resuscitate babies, you're managing snake bites, you're managing psychiatric patients. Sometimes you're the anesthetist, sometimes you're the pediatrician, sometimes you're the physician, sometimes you're the gynecologist. So I think that kind of experience that I had in my early career, that is what had a huge impact on what I ultimately chose to do as a specialty. I think another thing which really influenced me is that I lost my mother very early to blood pressure related complications. My father had diabetes for more than 30 years. He succumbed to the consequences of diabetes. He also had non-Hodgkin's lymphoma. He went through chemotherapy, radiotherapy. So I have a lot of personal interaction with healthcare as well. And all of this, I think, gave me two major learnings. One is I understood that it's important to manage chronic conditions well. So that is why I thought of becoming an endocrinologist, because if you manage diabetes well, then you can kind of avert the complications or the unwanted consequences of a chronic condition like diabetes. If you manage blood pressure well, you can help somebody live a longer, healthier life. So that was one of the main reasons I became an endocrinologist. The other very, I think, selfish reason of being an endocrinologist is it's a very rewarding branch. If somebody is missing a hormone, you give them the hormone, you change their life. It is so extremely rewarding as a human being to be able to make that kind of difference to somebody's life. So that is how it all came together, and I became an endocrinologist. And that is also what has shaped my approach, that more and more I realized that preventive care, good communication, patient-centered care, patient-important outcomes, that is what makes medicine so truly meaningful.
Great. It's a wonderful journey all the way from Vargas, Maharashtra to a big city like Mumbai. And as you said, endocrinology is indeed emerging as a very important branch of medicine, given that our population of with people with diabetes is growing larger. So, what are some of the major advances in the treatment of diabetes, doctor? What newer drugs and treatments, and what older drugs continue to be useful?
Well, I think for one, I would like to say I'm so grateful to be living in this time where we have so much to offer people living with diabetes. So I remember when my father was first diagnosed with diabetes, I was very young, and there was only one medication which was available, and that was a sulfonylurea. And everybody got sulfonylurea, and I don't remember metformin. And then if it didn't work for you, you were switched to insulin. So this is what the kind of treatment was available in the 80s and probably the early 90s. And there has been explosion of newer medications which are now available in the market. DPP4 inhibitors, GLP-1 agonists, SGLT2 inhibitors. So I think it's in a very exciting time in diabetes because we have a lot to offer the patient. It's like a cafeteria approach. You can pick and choose what suits your patient the best, and you can offer it to them. So I think it's an exciting time, not only for doctors, but also for patients. But of course, sulfonylurea and metformin are the, fallback guys, and there are some drugs that we can't do without. But yes, there's a lot of newer stuff coming on. So one is advances in medications. I think what is equally exciting in diabetes is the advances in technology. So use of continuous glucose monitoring, use of insulin pumps. So all of those newer insulins which have come, so they have made, I think, the management of diabetes more comprehensive. I think for a longer time we were just addressing only the upper layers of diabetes, but now with the advent of technology, we're able to delve deeper into diabetes and I think offer better care to our patients.
So great, you are having a better armamentarium now in terms of drugs, as you rightly pointed out, the devices, and probably even the what we call as digital therapeutics now has helped the better management of diabetes. So, what are the major challenges, doctor, in endocrinology today, and the newer advances in treating them? Also, your thought about the increasing role of digital therapeutics and wearables in enabling better outcomes for patients. You could also tell about your Fit to Fly.
So I think the biggest obstacle in India, what I see for the management of diabetes or in endocrinology or in any branch of medicine, is the sheer numbers that we see. So because we're seeing a huge number of patients, no matter how well intentioned you are as a doctor, it is well nigh impossible to offer all that you have to the patient, the time interaction that you have with the patient. So let me give you an example. So if I see somebody with diabetes, I would see them for about 15 to 20 minutes, 4 times a year. That's 1 hour in 365 days. And in that short period of time, just to listen to it, it's impossible to convey all that you want to the patient. And I think this is where digital therapeutics is going to fill the need gap. So I think the main concern was that a patient comes to me for 15 to 20 minutes. I tell them lots of things. I tell them medicine, I tell them diet, I tell them exercise, I tell them when to take the medicine, I tell them about the complications of diabetes, I tell them about children being at risk of diabetes. So there's so much of information packed into those 15 minutes. That the patient is probably not going to remember even 20 to 30% of what you've told them. So I think it's time to extend the care beyond the clinic and provide support to patients in between these clinic appointments, where whatever information you've given the patient, whatever treatment you want to give the patient, you provide them some kind of support in between your two visits so he or she is able to actually do what you've told them. So digital therapeutics can help with simple things like reminding patients to take medications, streamlining their diet, motivating them to do exercise, sharing videos, inspirational tips. A lot of the newer digital therapeutics also have psychologists on board, so they give tips and tricks how to manage stress. They monitor sleep. So I think that as a doctor, however well intentioned you are, it is impossible as a single person to do everything. It's time to extend the care beyond the doctor alone, use all the available additional things that we have like digital therapeutics, so you can truly offer the kind of care you want to give the patient. Diabetes endocrinology is not about medicines and hormones alone, it's so much more than that. So that is why I was attracted to Fit to Fly, because the first time I remember I met Arbinder, and he told me, you know what, Dr. Tejal, we want you to work with us in diabetes. And I said, look, Dr. Arbinder, I think enough has been done with diabetes. I want to work in women's health. And that is how we came up with the Heal PCOS program. That, when a young girl comes to me with PCOS and, I explain a lot of stuff to her, she listens, she's very motivated. And then within 10 days, she's forgotten everything. She's back to the usual diet and back to the usual exercise. So that's how the program came about, where we could motivate these girls, keep them on track with their lifestyle modifications. I think one more important place of digital therapeutics is also giving scientific information. That there's so much out there which is available on the internet about how you can manage all diseases by some X and Y magical cure. So I think that if you have a scientific program which is endorsed by endocrinologists, physiotherapists, psychologists, gynecologists, which offers state of the art care, then I think it's okay to go ahead with digital therapeutics.
Great, you have brought in a wonderful perspective that is quite sobering, that you see a patient for 15 minutes, 4 times, and that's just 1 hour in the whole year. And that digital therapeutics can be the real bridge between each visits, because I'm sure your patients do call you in between when they have queries, when they have problems, when they have probably even emergencies. And I
Right.
think digital therapeutics can serve as a great bridge and help you to manage your patients better and the patients to live a better life. So going forward, do you see digital therapeutics being prescribed by diabetologists as you prescribe any other treatment?
Well, I think it should be. I know that there's a lot of resistance by doctors. I think somewhere the resistance is because doctors, one, fear that something non scientific will be done with their patients, right? And maybe about 5 years ago, I would have agreed with them. But now, with this huge plethora of digital therapeutic options that we have, I think doctors don't need to worry that much about it. I also think that doctors can take a step forward and work with digital technology companies and guide them as to what patients need, right? So ultimately, when you help a digital technology company to understand what the patient needs, you're essentially reducing your own burden. You're still seeing your patient, but you're giving them more support than just you alone, right? So I think that there was a little bit of fear and resistance among doctors because they were afraid of patients being misled, misinformed, or misguided, which I think is not the intention with what we have right now. So that's one thing. Second thing is, I think the traditional way of doctor patient communication, which I'm sure you know, that when you were a kid, you went to the doctor, he asked you two questions, he wrote two pills, and that's it. You did what the doctor told you. Well, it doesn't work like that anymore. People want to know what medication you're prescribing them. They want to know how it works. They want to know if there's a way that they can avoid medications and do something to avoid them. So I think a truly well-rounded doctor would want to offer all of this to their patient. And I think the writing is on the wall, and whether you like it or not, you're going to have to accept it.
Great. That's a very important perspective. And I like the way you said that doctors should work with digital technology companies and explain to them what are the real challenges that you face. What I think often happens is that technologists work in isolation and they are in love with their technology baby, and the doctor doesn't find them so useful. So I think the
Right.
right way ahead is for the doctor to be involved in the process right from the beginning and guide the digital technology companies to design a solution that would be useful to both the physician and the patients. That's
Right.
wonderful. So I understand, doctor, that medical knowledge has been exploding. It says that now it's doubling at the rate of every 73 days. So what CME resources do you keep to keep yourself updated so that you can give the best care for patients? That's one part. And what about your patients? As you rightly said now, that today the patients are different, that they have access to internet and they want to know how even the drug works and whether they can be off drugs. And at the same time, doctors are hard pressed for time. So your thoughts on the future of how all these companies which give you so many solutions can add value to physicians as well as paramedics, in your case more specifically maybe the dietitians.
So that's a lot of questions. So I'll take them one at a time. So, about being updated and deliver better care to patients. So let me tell you what I think is that these specialists have access to the highest level of information. But somehow I feel the problem is that knowledge being percolated down and reaching physicians, general practitioners, family physicians who actually form the core of healthcare in our country. So, as a specialist, no matter what medication I write, they still go back to their general practitioner and ask them, you know what, Dr. Lathia has prescribed this medication, should I take it? Right? And I don't think that's something to feel bad about or to feel threatened about. I feel it's really important for the doctor to have one source who they trust. So I think part of the continued medical education should be the focus on empowering general practitioners, family physicians, and physicians with what is the latest knowledge. I think part of the problem with pharma companies is they become too focused on the drug. But I think that when you expand your perspective and you see that a condition which is treated better ultimately is a win-win for everybody. It's a win for the doctor because their patients have better outcomes. It's a win for the patient because they live a healthier life. And it's a win for the pharma companies as well, because when a patient is convinced about the treatment that they're getting, they're going to comply with the medication, they're going to adhere to the therapy. So I think instead of having this lopsided approach to continued medical education, probably need to broaden their perspective. So one is this vertical of specialist physician, GP, and family physician. The other vertical, I think, is a tier 3 city, a tier 2 city, and a tier 1 city. Again, there's a very disproportionate standard of care between a tier 1 and a tier 3 city. So these are places which I think that pharma companies can leverage this, expand knowledge, and then obviously impact patient outcomes. So that was the first part of the question. I think they need to move away from a drug-focused continuing medical education way to maybe a more broader perspective. The second part, which you are on Twitter, right? So just today, so I remember I was working with my website team, and I was saying about how patients read all sorts of rubbish things about thyroid antibodies, and my website team came back to me and said, "But why don't you write about it?" Correct. So I think this is one area that doctors really need to look at. We need to stop complaining that people are going onto the internet for information. It's their right, and an empowered, informed patient is one who's going to have best outcomes. So I think it's time for doctors to accept that people are going to go to the internet for sources of information. And if you as a healthcare practitioner don't like what is out there, then it's your job to put things out there which are scientifically accurate. And for this, you can use resources from pharma companies, you can read resources from medical associations, and you put the information out there which people can trust, which is accurate, and which helps them. But don't shout at patients or discourage them from going to the internet. So I'll give you a simple example. So when a patient today asked me, what, my dermatologist has said, use Canthex Plus. So what did I do? I went on Google and checked what was Canthex Plus, right? Because I didn't know what it was. So if as a doctor, I feel the need to access the internet, how can I tell a patient not to access the internet? But of course, if I'm not providing the information, then I don't have a right to complain that, oh, you read the wrong website and you should have seen this. So if you go on my website as well, the attempt we've done with my new website is exactly this. Instead of writing 100 pages on my achievements and my gold medals, who nobody cares about, we put information there about how to manage thyroid conditions, what are the small things of taking the thyroid tablet correctly, what is PCOS, we put videos explaining PCOS. So I think this is what doctors need to do. You have the information, it's time to share it. You can't keep all the knowledge to yourself and then complain that somebody is going to the internet. So maybe moving away from drug-focused continuing medical education to a broader perspective, putting out scientific accurate information there so that patients have the appropriate information. This is where I think most doctors and I disagree about the future of healthcare. So most people seem to think that drugs, devices, diagnostics, that is the future of healthcare. So yes, of course, it is the future of healthcare, and science will keep advancing and start giving us better options. But I also think that there's come a time for a shift in the way that we practice medicine. We need to focus on value-based care. What value-based care means, focusing on outcomes which are important to the people we are treating. For the longest time, when somebody comes into the clinic with a report, you assume that you know what they need. You start on your lecture, you write the drugs, and the patient leaves without even asking the question they actually came to ask. So it's time to address this very big need gap, that we need to understand what people need, understand the outcomes that are important to them, and then change or improvise our practice to address that. Simple things like that. So using digital therapeutics is part of value-based care, where you give them the full information. Having accurate scientific information is part of value-based care, where you give them enough information so that they can make a decision for them. So one is patient-focused care, value-based care. I also think that the future of healthcare is shared decision-making. You can't tell the patient that this is what you have. You have to give them the options. You need to tell them that this is the pros and cons of each option, and then allow them to choose. Sometimes doctors take it personally when people don't opt for the option that they think is the right one. But ultimately, we must never forget the person behind the diagnosis, that it is their right to choose what they think is appropriate for them. And with the same set of clinical parameters, the decision can be completely different for different people. And it's something that we need to accept. So let me quote from our language matters document. So this one patient with diabetes, very well-educated professor. And she said, what? Tell me my risks, tell me the pros and cons, but let me decide what I do with my condition. You don't get to decide for me what I want and do not want. For you, it may be important to keep me alive for 20 years. What may be important for me is to have a good quality life for 5 years. So I think patients say it best, and it's time the doctors start listening.
Great. Those are very, very modern and forward-looking perspectives. I'm sure that the modern generation, the new generation, in fact, would enjoy interacting with you, because in my days, we did whatever our parents told us. But now, as you said, my children would like to be involved in shared decision making, or even where they make the decisions and they just say, this is what we would like to do. So I think
Right.
uh, it's percolating to every area, and it's a good perspective that you have, that just as you search the internet for information, it is but natural for patients themselves to search for such information.
So just one thing that I wanted to say is that, see, the fact that the person is telling you that they looked up the internet, right, is because they want your opinion. So now usually what happens when a person comes into the clinic and asks you a question from a particular website, the doctor feels affronted, right?
Right.
But what they're not hearing is the person is still asking your opinion because it matters to them. They want you to confirm or deny whether they're on the right track. So instead of being upset, instead of being angry, you can acknowledge that the person is still asking your opinion. So sometimes when I finish my diatribe, the patient says, but doctor, that's why I'm asking you. So we fail to hear that, and we feel offended that somebody would go to the internet for information, not understanding that in spite of all that information, they're still sitting in that chair in front of you, and they're there because they value your opinion.
Right. I think that while patients do search for information, they have questions. I was just seeing a question addressed to Dr. Krishnamurthy today, saying that I'm taking my second shot, the same vaccine, but can I go to a different center? I know this is a stupid question, but I would appreciate your answer. So, when you really look at it from an empathetic point of view, put yourself in the patient's position, I think even the little thing matters to them, and an affirmation from the doctor means a lot to them. I hope pharma people are listening to this and they understand now what is it
Listening.
exactly that the patients are expecting, and what is it that the physicians are expecting from the pharma companies. It's not the drug-related information, which you can easily access, as you rightly said, as an endocrinologist, you're at the apex of whatever information is available, but it's rather the physicians, the GPs, and the family physicians who are actually part of the support system, who need the information about the new developments in better managing the patients. So finally, doctor, that we know that diet now plays a very important role in type 2 diabetes. And how have you been able to convey this to patients? What are some solutions to this challenging problem? Because even if you look at the city around you and the people around you, it becomes very obvious that we are not eating rightly.
So, yeah, of course, this is a question which troubles all endocrinologists, all doctors. But I think that we need to start from a place of compassion and empathy as well. What happens is that sometimes doctors become so rigid about the advice that they give. So patients feel a sense of loss of autonomy. They feel that, oh, the doctor always says what not to eat. They never tell me what to eat. So this is usually what happens. The patient will ask me, khane ka kya hai? So I'll say, ye mat khao, wo mat khao, ye mat khao, wo mat khao. And the standard question is, to doctor, khana kya hai? So I think one is we need to start from a place of compassion and empathy, understanding that it is not possible to follow a perfect diet 100% of the time. So one is when the patient says it's okay, you can give constructive solutions rather than being negative or judgmental or blaming the patient. For me, the solution that I have devised, I feel that, whenever a person with diabetes comes, most of the conversation and the questions that the patient comes with revolves around diet and exercise. So my solution to this is that my nutritionist who works with me, she's also a trained diabetes educator. She sees the patient before me. So before the patient comes to me, I already know what the schedule is, what is the lifestyle of the patient, what is the context, what kind of job they do, what are their eating timings, what is possible, what is not possible. So often I think that when you send a patient after your consultation to the nutritionist, one is you're undervaluing your nutritionist, you're also undervaluing the needs of your patient, because the medicine is a very small part of the treatment. The lifestyle modifications, the diet, the exercise, the stress management is as important as the medication. So I think that, and this is also what patients really desire. They want the doctor to understand their life, the context from which they come. They want doctors to give them meaningful solutions. So if there is a mother with twin children who are about 1.5 years of age, and I tell her to go to the gym 1 hour every day, she's never going to do it. So it's actually a rubbish solution, which is completely inappropriate. And probably the patient is thinking in her head that the doctor is an idiot. Correct? So
Right.
offering meaningful solutions is only possible when you understand the world that they come from. So that's the second thing. The third thing that I want to emphasize is that you can't, as we said, that 15 minutes 4 times a year is just not enough. So this is where digital therapeutics or having a full-time nutritionist diabetes educator on board in your system is extremely important. So patient goes out to a restaurant, a patient has a function in the family, they do have queries about diet. So either the coach from a digital therapeutics team is often available on a chat message to help them troubleshoot, or you have a trained nutritionist diabetes educator who can troubleshoot for you. So don't expect that you give the patient this one plan and this is what they're going to do for the next 3 months. Life is fluid. There are lots of decisions revolving around diet which crop up day to day. And that is why if we truly intend well for our patients, you have to have a team. The doctor needs to understand that it's time to stop working alone and you can't do everything for the patient. So one is compassion and empathy. Second is understanding the context from where the patient is coming, understanding their world to truly give them meaningful solutions, and always having a team approach with continued care. Always supporting the patient between appointments is extremely important. These are, I think, my top tips.
Great. I think that's very useful tips that you have given and should be useful to all our pharma colleagues also to understand that they should go beyond the product and beyond the brands and understand the challenges that a physician faces and how, like a simple thing that you said about the patient meeting the dietitian first and understanding their lifestyle. And so, you know, when the patient enters your room, that these are his challenges, and it's not
Right.
just the drugs, but the whole lifestyle modification that's needed. And given the challenges within which they operate, I think the solution can be made more technical as well, involving the digital tools. And as you said, your website can be a place where all the information can be made available, a chatbot made available, and so that it's not just 15 minutes 4 times, but in fact you become a 24 by 7 present doctor. And I think that's the opportunities in ensuring better outcomes for patients. So finally, doctor, before we wind up, how have you faced the challenge of COVID in terms of treating patients? Have you become more digital in adopting telehealth? How's it, and how's it looking forward? What are you looking at, doctor?
So thank you for that question. It's my favorite question, I think. So with due respect to all of the lives that have been lost in the COVID-19 pandemic, I am truly grateful to this pandemic for opening up digital technology for doctors. You know, I'll share something personal with you. So in August of 2019, I was setting up my website. And at that time, I remember telling the website team that, you know, there are these groups of patients in endocrinology who don't really need to come into the clinic and wait for 3 hours in the waiting room. I just need to see their thyroid report. I need to make small changes in their thyroid doses, and they're set. And but this one person is spending 2 hours commuting, taking holiday from work, sitting out 3 hours in the waiting room, and wasting a lot of time. There are young mothers whose kids are small, they're stressed, the hospital staff is rude. So that is the time where I actually had already integrated online consult in my website. And this was August of 2019, and the pandemic hit in March 2020. I've done almost 1,000 online consultations on my personal website over this past 1 year. And I think it has been so rewarding because patients were relieved to be able to access their healthcare worker from the comfort of their home. They wanted to see the same doctor. They want that continuity of care, that, I know this doctor, I trust her, she knows my medications, she knows my history. I want to be able to see her. And because of the pandemic, they haven't been able to see their doctors. So I think online consultation works great. And I hope that this continues for the future. So one small example. So this week, I had one consultation from New Zealand, I had one from Australia, I had one from the US. So they were all people of Indian origin, facing various problems across the globe. So one had rheumatoid arthritis, one had hyperparathyroidism, and one had hyperthyroidism. They've been given treatment options by their doctors, but somehow they wanted that second opinion from their Indian doctor. So that's what we did this week. Another very, very rewarding situation, I'll tell you. So I had a patient whose wife saw me when they were living in Mumbai. Now the patient's wife and him, they moved to Kolkata. So I have a conference call where I am in Bombay. He is in Kolkata. His brother from Ahmedabad has joined, and I'm consulting a patient in Jharkhand. This whole family, all of them have diabetes, every single family member. So because of that, I'm already treating 3 brothers. So when the young nephew had obesity, they were very worried that the nephew would now get diabetes. So they wanted me only to see them. And we were 4 people in this call from 4 states across the country. I think this is something where 20 years back, you wouldn't even be able to imagine that you can do something like this. So I think this is what the potential of online consultation is. And yes, I know that it's not a substitute for a personal consultation, but in some cases it can be life-saving, and this small, and it's so poignant. The young kid, 12-year-old, is in like a shack somewhere in Jharkhand, and to tell them, to be able to guide them for diet, to guide them for exercise, to talk to his mother, to talk to his father. The whole family is there. Everybody understands what the situation is. Now suppose they had come to Bombay for treatment, then some mama or chacha would have come with the child. They wouldn't even get the parents with them, and that kind of consultation would be an incomplete. So I think it's really exciting, and I hope that this trend continues.
Great. So you have been very successful in adapting technology and not only seeing patients, your regular patients, but even new consultation from across the world, in fact. And that shows how technology can bridge borders. I think I can imagine a future where when you are coming to work in your car, you have a chauffeur and you can sit back in the back seat of your
No,
car.
I love driving. I refuse to have a chauffeur. I love driving.
Okay, let's say you'll get an automated driving or new system, and you can actually do a telecall when you're 1 hour, 2 hour you're driving. Even that time can be used. Final comment from you, doctor, as to what about the pharma people? I've been a pharma rep in the 80s.
Afraid to answer that question. I'm afraid to answer it.
No, no. But what about the digital adoption by them? Has it happened? Do you expect it to happen? Because I'm sure, as you said, you have a challenge giving time to the patient. So seeing reps would be even more challenging, giving them time
Yeah.
even more challenging. So how do you look at the pharma's interaction through the digital medias? If that's you can access what information you want through which channel at your convenience.
So I just want to say that I think pharma companies so far have been pretty short-sighted in their approach. Forcing young medical representatives to badger doctors and, insist on appointments, and, that kind of sometimes puts doctors off rather than engaging. So the intention is to engage the doctor, but what you actually end up doing is annoying the doctor, who doesn't then really want to even communicate with you. So I think one is, the strategy needs to change, that there have to be better ways of reminding the doctor of a particular medication than just badgering them and hounding them. So I don't know how they can do it, but understanding that frequent visits are not important. So one of the common examples, I know I'm being recorded here, but I'll just give you an example. So this young pharma rep and say, today my ZBM is coming, please meet me, doctor. Today my RSM is coming, please meet me. So I remember this one company, I will not name, it's a very young girl who I like very much, and we get along really well. And every week some other manager will come. the managers not understanding that they're actually putting the relationship of the doctor and the rep at risk here by pressurizing the rep to continue to engage with the doctor every week. So I think that managers and the upper echelon really needs to look at the strategy that they have for doctor engagement. Digital medium, yes, can be helpful, but I think one of the places where really they could leverage and improve their relationship with doctors is helping doctors save time. So
Right.
instead of already making it worse, so you remember once on Twitter we discussed about this, maybe a concierge service where you help doctors to help patients better. So ultimately the doctor is interested in the patient outcome. If your medication is helpful the patient for the patient, the doctor will write it. If it's not helpful, no matter how much you push it, they're not going to write it. So I think engaging in a less annoying and pressurized manner, understanding the challenges of young medical representatives and not putting their relationship with the healthcare provider at risk, maybe devising strategies where they can kind of share the burden with the healthcare provider, which is more likely to have a positive impact on the doctor rather than what they are currently doing. I think some of the pharma companies have got into digital therapeutics now. They're offering it as part of the therapy and all, but again it needs to be a long sighted approach. It can't be just like this short sighted approach where ये गोली के साथ है और ये गोली के साथ ये फ्री है, फिर डॉक्टर आप ना पेशेंट का नंबर हमको दो. You can't do stuff like that. No, it doesn't work. So they really need an overhaul.
So thank you once again, Doctor. It's wonderful that you could take time. I really appreciate that.